and I do the x-ray. Ma'am, you have huge infections. These teeth need root canals and crowns, and one of them needs to be pulled. It's just bummed down underneath. But you can't see that underneath that thick, bulky white thing.
Yeah.
You're just like, but something doesn't feel right, bro. Your whole face is about to explode, bro.
All right, guys, welcome back to the Rio Grande Podcast. My name is Sam. Good morning, good afternoon, whatever time it is. Today, we're going to have some fun. We're talking to Dr. Ebere Iheanacho.
Yes, sir.
What's up, man? There we go.
The ExtractionKing.
I should have said that first, Mr. Extraction. That's your handle everywhere, right?
That's my handle on everything. Well, except for TikTok, then it's Royalty Smiles. But
okay.
I'm ExtractionKing.
Yeah. So Dr. Ebere, ExtractionKing, is a dentist. You know, if you already know that because you're following him on everything anyway, right?
Hey, yes, sir.
You already know who Dr. Ebere is. But we bothered him. It was a pretty mutual thing.
Mutual.
We wanted to. I actually had been seeing your stuff for a while, but I didn't like I didn't look at your backlog of stuff.
Mm-hmm.
And then when we talked, I went back and I was like, I remember that you had like a pretty legit amount of following, which is kind of rare, especially like I don't mean to like diss the dental crowd, but like for dentists, like to have that. Like that big, which is it's a compliment.
Absolutely. I definitely get a lot of inboxes from dentists asking me how in the world do I do it, and how am I doing it? And I don't know. I just do it on my own on my phone.
Like, who's your marketing specialist?
I know, dude. I mean, I don't have a marketing team, but hopefully in the future that becomes a thing. But I want to get it to where it's very organic. You know, people are following me from just naturally loving my content.
They feel that it's real, the connection.
Yeah. I'm not paying for bots or anything like that.
Yeah. So anyway, so I went to go check out his stuff, and dude, your stuff is hilarious, man. I was thinking, okay, he's got like, what is it, like 25,000 on Instagram?
25,000 followers.
Okay, I was like, okay, so this guy's really good. Like, he can teach people stuff. But when I went to it, it was a bunch of sketches, man, which was like a nice surprise. Like, oh man, like I was thinking it was gonna be like I don't know, like a lab coat, like teaching us about like why our teeth are terrible and why they're all yellow and dying. But it was funny, dude. Like I like your style because it's especially in your field, man. Like I don't think I've ever seen like a dentist like going all out like that.
Yeah, well, I definitely don't want to make my page boring, right? People already hate going to the dentist, so I definitely surround my page around. I would say if it was 100% spread out, I'd say it's about 50% my personal life. The skits. Well, the skits would be 50% as well. Well, 50% the skits, 30% my personal life, and about 20% of my actual dental work content. Okay. And it's just so people can really get to feel comfortable and get to know me.
Yeah.
Before coming in my office, you know exactly what to expect, you know?
Yeah, that's true. Let me ask you this. I was going to ask you about your journey first, but you got me wondering, like, are people still scared of the dentist? Like, is that still a thing?
Yes, I get that a lot.
But I mean, here in the Valley also?
Yeah, here in the Valley. I mean, I have a lot of people, you know, they haven't been to the dentist in so long simply because they had a traumatic experience from when they were younger. And now it's gotten to the point where now my teeth are falling out of my face. Can you please help me? And can you understand I have an anxiety and a phobia for dentists?
So it's legit avoidance. Like,
yeah, it is
real. It's affecting their... So like, what's the fear though? Like, why are some of us afraid of the dentist?
I'm gonna say one of the top three for sure is they're afraid that it's gonna hurt during the procedure, and they're going to tell me, and then I'm going to not do what it takes to make them not be in pain. I've heard a lot of stories where people were saying, "I told a dentist it was hurting, and they just kept going." And I can't even comprehend what that means as a dentist who cares, right? Yeah. But a lot of times it's like, well, they just couldn't get me numb. And I've never had that situation in my office. So I'm knock on wood, I'm so grateful. Yeah. But my patients come first. You got to make sure somebody's not in pain while they're there. Like, what in the world?
So it's not just like an irrational phobia. Like, they have experiences that...
Part of that is from experience. Part of it is also from their parents, the people around them. If they're always saying how horrible it is to go to the dentist, why would you want to go to the dentist? If you're raised in the house of your parents, always being terrified of the dentist and trying to avoid the dentist, because as kids, we're always listening to our parents. There's nothing going to influence us more than our parents next to, personal experience.
Yeah, that's true. But what's the terrible thing though? That's what I'm saying. Like
the drilling, the noise. They don't like the noise.
Oh, okay.
They don't like, it's really the noise, the shots. People hate shots. Like, even if the shot, like some people have legit told me, I hate shots so much. Could you possibly cut my teeth without the shot? And I'm like, it's going to hurt so much more.
Yeah.
The shot's so temporary.
Okay.
Yeah.
That's true. Because I mean, the reason I'm saying that, like a lot of people are afraid of injections and but I don't hear as much. I'm afraid to go to the doctor. I'm afraid to go to the dentist specifically the dentist.
You get a shot in your mouth, right? It's a double whammy. Yeah, you're scared of taking shots. A lot of people have a phobia for getting shots in their arms. Yeah. Now let's multiply that fear times 1,000 by saying I'm going to give you a shot in your mouth. Our teeth are very our mouth is very sensitive area. You eat something that's hot, it burns you. It's hurting for like a next couple of days.
That's true.
Things like that.
Burn your tongue or something.
Exactly.
Yeah. Mm-hmm. Yeah, so that's true. Okay, so we're talking to Dr. Ebere here. Where your office is in McAllen or Mission?
It's in McAllen, kind of Mission, but it's right next to Mr. Krabby's.
Okay.
Right off the expressway, between Ware and Sherry.
We passed by it like 2 days ago.
Dude, it's right off the expressway.
I'd never seen it. I had never seen it.
You see it all the time now.
Now, 2 days ago, we went to S Market for the first time. That was like an Asian grocery store. And I was taking Allie. She wanted to hang out somewhere, so I was taking her there, and I was like, "Wait, dude, I think it just passed like Dr."
Yeah, once you see that sign, man, it's kind of infiltrated. Everything I do or I build around my brand is kind of really just to have this second nature. You're like, where have I seen that before?
Yeah. It's gonna stand out.
Exactly.
So you're all about the branding.
I really am infiltrating.
Sorry, I gotta ask you, man. So, like, you're practicing in McAllen Mission area. Are you from were you raised here in the Valley or?
I was not.
Okay.
Yeah, Soy de Africa. No,
Soy de Africa? Never heard that before.
Yeah. No, I was born in Africa, man, and my parents brought me to America when I was about 7 or 8.
Okay.
And I grew up in Dallas, Texas.
Okay.
That's where I went to undergrad. I went to UT Arlington, and then I got accepted into Baylor Dental School of College, which was in Dallas, the heart of Dallas, downtown Dallas.
Oh, that's in Dallas?
Yeah,
cool.
Yeah. So then I got a job offer in my 4th year from a dentist that was from the Valley. And nobody knew of the Valley. He was presenting it to the whole 4th year lab. And one undergrad man was like, I'm from the Valley. You should go. It's really cool. You're the guy he'd be looking for. He needs people who can do surgery. I went out there, checked it out. I fell in love, man.
Yeah?
I love the Valley. I really do, man. You can't even make that up.
You had never been here? You had never heard about it before?
Not in my life.
Oh, man. Okay.
And I took the job, worked for about 6-7 months, and then I quit. And then my mother was like, oh my God, so you're coming back home? And I was like, no, Mom, I'm staying here. I don't know. I just saw a future here, man. I saw mainly, man, at the stage of my life where I'm at, I saw mainly that I felt like I could raise a family here, bro.
Yeah.
It's just, Dallas is very high, fast paced. I don't want that around. I want to go to it. Now the Valley has its own set of funds now. Like there's fun here, but but you get a lot more of it's a little calmer, bro.
So is that why you stuck around? Or what was it that, you just said, I love the Valley. What was it that made you feel like, whoa, this place is cool?
Well, the cost of living, right? The cost of living. I really love the Mexican culture, bro. I love the food. I really wanted to learn Spanish. I took Spanish in high school, in middle school, high school, college.
In Dallas?
Yeah. Well, all through my educational career, I was always like, do you want to take an elective? It could be a language. I'll take Spanish,
Okay.
And I was always just ace it, because I just really loved it, bro. I loved, writing it, reading it, and speaking it. But
so you speak Spanish?
Poquito.
Yeah, you can speak to your patients and stuff like that?
Yeah, I got a little spiel. Hola, mi nombre es Dr. Ebere, mucho gusto.
Dude, that's cool, the accent,
mi español
man.
No muy bueno, pero mi asistente ayúdame.
Dude, that's... I never... So was that a Nigerian accent, or...?
Nah. Do I have a Nigerian accent?
Well, when you speak Spanish, I got a little flavor there, more than I had heard before.
It's just whatever I feel like it sounds like. It depends on who I'm talking to. You know what I mean? Vote para acá. I just speak it, but the accent to me is major. If you're not speaking any language with the right accent, what are you doing?
That was pretty good though, man. For real. That's why I was like, whoa, like that was interesting. Because like, how long did you live over there? Like, because you said you were born in Africa.
Yeah, I was born in Nigeria. Nigeria's in Africa. I lived there till I was about 7.5.
Okay.
Yeah, and I never was really into teeth. You know.
Okay.
A lot of people think like, you know, man, this guy must really love teeth. You know, I'm like, no, I actually never thought about teeth. I was into more cosmetic. I wanted to be a plastic surgeon.
Okay.
Yeah, and then that kind of, I took the test, the MCAT test, a couple of times, and you know, I got approached by some girl who just took a different exam, which I came to find out it was a dental exam. She just kept talking to me. I was like so annoyed because I didn't score well.
Yeah.
And I don't know, God just, I know it's God, bro. I just turned to her and started talking to her and didn't want to be, don't be like that. You're frustrated. It's your thing. This girl's being nice. Oh. I started talking to her. She tells me the parts that I was struggling with weren't on the dental exam. They replaced it with math and this puzzle thing or PAT, perceptual ability test.
Yeah.
Bro, I went straight from, I scheduled my dental exam a week after I spoke to that girl. I scored average. And I was like, what?
A week after?
Yes, I can't even score average on an MCAT. And I scored average.
And it wasn't on your radar at all? Like the dental, at all?
Not at all.
What? And a week later?
Yeah, bro. And then like after that, I studied for it real hard. Like took it a year later. I scored in the top 2 percentile. I knew this is the path God wanted for me, bro.
Yeah,
like
it was clear.
You can't, bro. It don't get no better than that.
Man, dude,
so great.
Like a week of preparation got you higher than.
And then we both applied. I would stay in connection with the girl. Mm-hmm. We both apply. I get in. She didn't.
Oh man, bro, and she was the one like guiding you.
I know. And I was just like, God.
Like, what do you tell her? Right? Like,
what happened, God?
I don't know. For the advice.
Yeah, I mean, well, yeah, and then, but you know. She got in the next year, so she graduated right after me, and she owns a practice, has a beautiful family in Houston. God is great, bro. That's a path for everybody. That's enough for everybody to be successful. Everybody can be great. Everybody can, win. We're not in competition with each other.
Yeah, that's one of the biggest things. It's like instead of helping each other out, like you just.
Amen.
Yeah, because then you never build together.
I'm so grateful. She talked to me.
Man, and then the dental school was in your hometown anyway, right? So you were already in Dallas.
There was only 3 dental schools in Texas.
That's what I'm saying. Yeah.
And I had one right there, and I was just like, all right. So I just went up there and kept bugging them,
Yeah, because I know like dental and like vet school, like in Texas, there's only so many.
Yeah.
And so I'm like, man, you were already in the.
They only accept like 100 people a year.
Yeah, I can imagine.
So 3 dental schools, 100 kids a year. That's 300 dentists a year. How many people are actually being born in Texas a year? A lot.
Yeah, that's true. And you made it that cycle, the very first. Dang, dude, that's crazy, man. Yeah. Okay, so that's how you got here then. So you found out about a job opening or something? Well,
yeah, they usually have these things called lunch and learn at dental schools where people can, during your lunch hour, they'll be in this little auditorium. They'll come and try to pitch whatever it is they're pitching to the future the soon-to-be dentists.
Yeah. Okay, so you were like a 4th year. They're like trying to get you out there.
Exactly.
So and you're like, okay, you listen to your classmate like, all right, I'll go check it out.
Yeah, because he was a pretty. His name is Luis Padilla. He's now a dentist here in the Valley as well.
Really?
Yeah.
Okay.
Yeah, but I mean, he
came back home. Yeah.
He did, and a lot of people don't typically go back home, especially when they're exposed to those big cities.
Yeah.
Just like, bro, people, if there's anything I heard more than anything from people in the valleys, I want to get out of the valley. And as a person not from the valley, I'm just like, I promise you don't.
Dude, that's the
it
thing.
Ain't what you want out there, man.
That's the thing for locals. Like kids that grew up here, like they're itching to get out, like as soon as they can.
Yeah. If you can't hold a job down over here, good luck up there. It's just not. Things are way more. It's way more demanding. Is all. If you don't have family, and then it helps to be around your family. I think the main thing to me is life is very important to stay close to your family until you're really who you need to be. Like I don't think that people should be kicked out of their homes at 18. You're 18. Get out of here. Go be a man.
Western system.
They don't know how to handle anything.
Yeah.
I didn't.
Yeah, you look back and it's like, you think you're an adult at that time.
But
it's like when you're 18, you're at the top of the kids, but the very bottom of the adult. So it's weird because like you feel older at 18 than you do like at 21 or 25. That's probably because like you're the oldest kid. If you don't you think you're an adult already, you're like,
until life starts to process.
Yeah,
Like,
yeah.
I'm not anywhere yet.
Have you had all your family come down and check out the area?
Oh yeah. My family's my mom and dad come quite often.
Okay, cool.
They like to drive, which is like 9 hours. I hate it.
Yeah,
It
yeah.
gives me anxiety, bro. I'm just like, the flight's an hour, Mom. I'll pay for it. And she's like, no, I do not want to. I do not want to go. Please, they will kill me on the plane. My mom is very.
Oh, she doesn't fly?
Man, my mom is so paranoid about flying, but she'll drive 9 hours. I'm just like, Mom, the statistics are there.
That's true.
This is worse to drive. You know,
planes is like safer.
Yeah.
But she flew to get over here, no? Because
yeah, well, yeah.
Yeah, like
the first time, right?
Yeah.
She was terrified, bro.
Oh, really? Even like, so this is like maybe it's like a phobia for her? Like,
Yeah, for sure.
Oh, man.
Yeah, and then, anytime you ask me about my mom, I usually turn on an accent. I just always just...
Yeah. Hey,
can't tell
you had it in there, man.
I can't tell you a story about my mom without being my mom.
You had it in there for real. That was cool. So I want to ask about this, man. Like, I guess give us a little report card of how we're doing, because we had a guest on like it was probably a year ago. Our friend Ariana, she has like a dental hygienist account also. And she was telling us that we suck at flossing, man. Like I don't know if she meant everywhere or like just here in the valley, but she was saying that, like, we just don't do it, and she can tell as a hygienist, like, you can't really lie to her.
Yeah.
How are we doing in that world, man?
I believe
in that department.
I would say, because I've been in the valley for about 10 years now, so I'm not new to this. You know what I'm saying?
Yeah.
So I would say flossing is a generalized issue for everywhere. It's not just in the valley, but that whole idea of oral health or oral hygiene is pretty poor. If I had to give you a report card grade for the valley so far, I'd say it's a D plus.
Yeah, everyone's gonna believe that.
I'm not even sure. I can't sugarcoat it, man. No,
yeah.
A lot of it is people. I think a majority of it is not just the flossing. It's the fact that people can just cross the border and go to Mexico to get dental work.
Oh yeah, for sure.
So a lot of times they're getting faulty work done by people and coming back and holding on. Like they plan their life around when they can afford it in Mexico versus how about not get like a board certified dentist here.
Okay, so you mean like preventative? Like they're waiting until the emergency? They
wait for the emergency, and then when they have a tooth that needs help, like a root canal, they'll go across the border. And I'm not saying every dentist in Mexico is bad.
Yeah.
I don't know where they're going, right? Like, I don't know who they're going to, but I would say most of the work that I fix from Mexico, it's really just poorly done work.
Because you see it, yeah.
I mean, well, if it costs $1,000 to get a root canal here, and you go to Mexico and get it for $80, there might be a discrepancy in the work.
Yeah, that's true.
You can't come back all arrogant like, I didn't have to pay $1,000 because your tooth doesn't hurt. Do you even know what they did to your tooth? Like, how do you know it's done correctly?
And we're never going to know.
You'll never know.
Yeah.
Most people say they love their dentists because they're cool or they like them, not because they know how good of a dental work they're doing on them.
Well, that's true. Just in general, right? Yeah. Yeah, because we don't have any way to gauge. Like,
I have no idea.
Yeah.
So I really harp a lot when people come into my office to make sure I show them the x-rays. And I know you might say, well, you show me the x-rays, I'm not going to know what the hell I'm looking at, right? I make sure I circle the areas. Like, look, right here. I show them examples. I use my camera phone. I'll take pictures of it. If it's cavities that are visible to the eye, I will take a picture and show it to you. I'm not just going to tell you, here's your treatment plan. You have all this stuff. A lot of people don't even know they have a hole in their teeth sometimes. It's just like, well, here, there's a picture of your tooth. You know your tooth didn't come with that hole, right? You know, and then then they're more willing to move forward, you know, because a lot of times people feel healthcare professionals are kind of just doing it and taking their money, bro, like because of the costs and all that. And it's not like, if I diagnose 10 fillings on a person that thinks they have no cavities, first thing you need to remember is, as a dentist, I don't want to do 10 fillings. I don't want to do 10 fillings. That's a lot of work.
Oh, okay.
I'm calling this out because I have to. I'm like, you kind of know what I'm saying? Like, we don't want to do I'd rather get to the root of your problem quicker. Fillings take a lot of time.
Yeah, for sure.
But if you have fillings, you have fillings. And somebody will be 40 years old and say, I've never been diagnosed with a filling. How could you say I need 5? Ma'am, you're 40 years old. You've used your teeth. They're like it's like a car. A car's gonna eventually need work. It's like it's a machine. You're gonna get eventually a hole in your teeth over time.
Yeah, it's naturally gonna happen.
You're using it. It's like it's not metal.
Yeah, you see, we need to hear that though, because we don't connect those dots ourselves.
Facts.
We're not thinking like, oh, I've been using my teeth every day for how many days in a year, how many years. Like, we're not doing that math.
I mean, if you've never had a cavity and you're over 40 and you're going to the same dentist, you might want to check out another dentist.
Yeah.
And if you see a black hole in your teeth and it bothers you and you ask your dentist and the dentist says, don't worry about it, you want to check with another dentist. Don't think because your dentist is avoiding to do work means that they care about you.
Yeah.
Because that's really where it's coming from. It's not that you have perfect teeth. It's sometimes they don't want to do it, or they don't want to bug you and tell you need. But you need.
Does that happen?
Health. It's your health, man. You need somebody to tell you. You need something done. Like,
does that happen where like some dentists are not really gonna like I'm gonna ask you this.
Yes,
I'm gonna ask you this straight up, man. I didn't want you to become like. I mean, we can go about this however you want, right? I didn't want to put you on the spot, but how do you feel, or is there anything? How can I ask this? So we have these theories, these conspiracies, we'll say.
Oh my God! I already know about fluoride. And all
no, not that, man. Not that. Not even that. I have these theories about like some of these dental chains. Like the rodeos out there and all the safaris out there.
You gonna put this on there?
Dude, okay.
Let's get it.
Dude, I didn't want again. So this is Dr. Ebere. He's cool, man. He's coming on the show. He's talking to us. He's being real. I didn't want to get you like hate from all the other dentists out there.
You think I care, bro?
But I do want to ask you though, because again, so like this is for the Valley, right? So we're talking. This is like for like for the general public.
Absolutely.
I've heard a lot of bad things about some of these dental chains.
Absolutely.
After I heard those things, I personally had an experience where I needed to get my wisdom teeth out.
Yeah.
And so I work in the healthcare field too. I don't think I've ever said what I do, so I'm just not going to right now. But I work at a hospital.
Okay.
Right. And I was having to take time off for other things too. So I had a limited amount of time to go to the dentist. Because if any of you guys work in healthcare, you know that it's hard to find time sometimes.
Yeah, you can't just be taking time off all the time.
Yeah, especially if you have patients to see.
Exactly.
Anyway, so I had to go on a Saturday. So I was calling all these places. Dude, they were all booked for like weeks, months out. So I called this place, this chain in San Juan. I kind of want to call them out, but I called this place and they were like, oh yeah, we'll take you on Saturday like at 2:00. So I went, right? And just that turned into like 3 appointments. It was just like the worst experience, and they told me it's like a bunch of stuff. And I afterwards I went to like YouTube and I was reading what they were saying. They're like, yeah, all of them will tell you have like 1 million cavities. All of them like they don't like they have quotas, or like they don't really like they have to answer to their higher ups, and they have administration.
No, we're talking about chains, right?
Yeah, exactly.
They're called DSOs.
What is that?
DSOs, dental something. I don't know, organizations.
So there's a whole like framework structure for that.
Yes, bro. And these people that own it, typically they have dentists. You have to be a dentist to own a dental office, but the people that own it are just big money people. They fund all the money. So there's a system in place where it's really a numbers game. They see just numbers of people. A lot of high turnover in the dentists that work there. They usually going for young dentists coming right out of school, and those dentists quit after they make so much money because they're having them do unethical things on teeth, but racking up all the money. So,
but those are dentists too. Like they went to dental school.
You mean the people that own it all?
Yeah. You said
they only have to be like 1 or 2. Oh, you only have to have one dentist to
like,
have
like a medical director equivalent.
Exactly.
Okay.
So you could have a lot of investors with just one dentist. Do you feel me now?
Yeah, but they're all owners.
It's just a business. At this point, it's a business. It's not a healthcare structure.
Yeah, for sure.
So, they work them to death. They'll work them to death. They'll tell them how to diagnose, right? So that's already compromising your ethical beliefs. They tell you, drill and fill, just push them in and out. They target Medicaid people a lot. You'll see them at the polgas. You'll see them. They're aiming at Medicaid.
Oh, yeah.
Medicaid is government money. They're going to get it. And they're just... like they'll feel, they have Medicaid. Just do 10 fillings on them right now.
We do see them at the pulga, dude. They have tables and like outside HEB and stuff like that.
They just like trying to get it, and then you go in there with your kid.
Yeah,
your kid will come out with 20 silver teeth, and it's just like, what in the heck?
So that's legit. Like,
what was the rush?
But is this known? Like, do dentists know about this?
Well, a lot of dentists do know about this, but the dentists that work for these DSOs better not say a word, right? Like they're all trying to secretly make enough money to go open their own office.
Okay.
Yeah,
that's why they're there.
Yeah.
Because I was gonna ask, like, what's the incentive? Like, if I'm a dentist, why do I want to work for a DSO?
For a DSO, because you have kind of like a guaranteed marketing team that's going to bring in a ton of patients. And it might be a lot of work, but you're getting a percentage on just doing a bunch of work. But you learn nothing about business. That those DSOs are built to make sure you know nothing about growing yourself. They want to keep you stuck there. You know what I mean?
Really?
Yeah. So you're just working, being tired. You can burn out working as a dentist. Come right out, go there. Don't work more than 2-3 years at those places. You will burn out and hate your job.
Tell me more about what happened to you. Dude, so I mean, it was like, for example, one of the things that happened, the reason I needed to go on a Saturday is because I went to like a private practice dentist. And he told me I needed to get the 4 done with an oral surgeon, right?
That's what they all say.
Yeah, so I had to go get the 4 done with an oral surgeon. So I was like, okay. So I went to the oral surgeon, and something happened where like, I didn't need it like right there and then. They're like, you could wait a little bit. So I waited. But before that 6 months ended, I went, and then the dentist was no longer there. So they're like, we have to do a whole new. Like X-rays and everything. So I was like, man, like I need to get this done now. So then I started calling other places, right? And then that place said that they would see me at least. So anyway, one of those chains said that they would do three extractions. So I was like, okay, yeah, just do them. So they did the 3 extractions, and then later on, I found out that there's like I'm not a dentist, man. Right? I don't know anything about dental. Like, they were supposed to give me like some. Like I guess a syringe and a flush and all that.
I give you a syringe and flush too.
Yeah, well, they never gave me like that or instructions. And then on top of that, they didn't even tell me about the like to make that I need to keep the clot or whatever.
Gauze.
Yeah. Like they gave me gauze, but like they didn't really tell me anything what to do with it.
Any post-op instructions?
Nah, dude, not at all, man. And I was like, at the time, I was working a lot. And I was grateful because at least I had the extractions out and I didn't have to do it with the oral surgeon.
Exactly. Because the oral surgeon would have cost you an arm and leg, man.
Yeah. And it wasn't even necessarily only about that. It's because it was hurting me already. And like, I had
just wanted them out.
Yeah, man. Out already. Like, I just need to get this done. So, I mean, I was cool with that. But like, I had to wait like for like 6 hours in the waiting rooms each time. And there's a bunch of stuff like, they were like, I don't know, dude. It was I don't want to. I hate calling out businesses like this, but it was just not good, man.
It's not customer centered.
And another dentist was telling me that like that I probably didn't have all those cavities, and that he was telling me that they do fillings for no reason on a bunch of people.
Did I not tell you that already?
Yeah, dude.
Did I not tell you that already? I can't make this up.
And I
those and they would just do it on your teeth. How dare you? Like, how dare you cut my teeth?
So I feel like they probably did that because I'm telling you, man. Like I take care of myself, dude. Like I haven't eaten sugar in years, man. Like dude. I at all. Like I haven't had a piece of candy in at least 5 years.
I have
not one piece.
I have a similar story, man. I used to be a school teacher, right? I was a school teacher for 3 years, and I had dental insurance. And the last year before I was gonna leave, I had no idea I was going to be a dentist at this time. I just knew I had a tooth that needed work done on it. Man, now that I think about it, now that I'm a dentist, it was probably just a filling. They put a cap, a crown on. I did an exam on myself like 5 years later in dental school. I had no cavities, no nothing. So what are the chances my teeth needed a whole crown? Do you feel me?
Yeah.
It probably was, because I remember it was just a little hole, but it was bothering me. Why did you put a whole crown on my tooth?
But they're going to charge more, right?
Exactly. And as when I was a teacher,
and
as somebody who really cares about my health, I'm just like, okay, cool. All right, well, just do what you got to do. Because
you're not going to question the professional.
Come on, dude. He's a professional. Just like I kind of feel that way sometimes when people come to my office, when they tell me they've looked on YouTube, right? Cough, cough. And now they're telling me what they think I should do on their teeth. At that point, I kind of just want them to go somewhere else because I don't want to compromise what I know I'm seeing or want to do. So yeah, no, that happened similar to me. Once I got more educated, I was just like, what if I ever put a crown on a person that never had a cavity? What in the world?
Yeah. Like they skipped the whole cavity side. They went straight to...
Exactly.
I see what you mean now.
That's why another thing I was trying to mention earlier was like, if you are about 35 to 40 years old and you're going to a dentist regularly and have never gotten a filling or anything, I've had patients that have told me they've never had fillings or anything, and they're coming in there and they need a root canal. How does your tooth go from no filling?
Is that like a lazy dentist or what? Like they just don't want to deal with it?
And they just ask you, if you don't tell them a tooth is hurting, they don't want to do fillings. I'm right. I mentioned that.
Yeah.
Fillings are kind of like, it takes, you can cause more issues to a tooth if you don't do a filling correctly. But fillings have to be done. They're like the starting step before your teeth goes further and further into more, decay and whatnot.
Yeah.
But
Kind
to
of
go
stops
from no fillings to you've been going to me the whole time, and all of a sudden you say, "But this is starting to hurt." Yeah, you're gonna need a root canal. The first thing you as a patient should ask me is, "Did you not see it last time?" Like,
Oh yeah.
it can't go from nothing. It has to go to a filling, to a big old hole, then to the nerve. Dude, your tooth had to be going through some stages, bro.
And they just
takes
watch
about
it
a year or
happen.
so for that to happen. Yeah.
So those are just two extremes then. Like one, they're doing a bunch of stuff. The other side, they're not doing anything.
Yeah.
And both happen. But
You
isn't
have
that
to
like
find a middle point? And
isn't that like lawsuit? Like that's super unethical. Like,
Yes.
like if you're doing stuff on me that I don't need.
that one's more of the lawsuit. The other is not, right? Because they didn't do any work on you. That's up to you to go find a different dentist,
Yeah,
right?
yeah. But if you're messing with my teeth,
exactly. But how do you at that point prove you didn't have a cavity once it's already been cut and drilled and filled and you signed the
so
consent
that's why it
form,
works. Then that's why it works,
Absolutely. That's why do you think they did them all so fast on you in one day?
dude. And I didn't question
Less
it,
time for
man.
you to
And it
even
was
think.
one of those stupid
Dude, I'm
chains,
telling you,
dude.
bro. They rushed the treatment on the patients. It's
It
crazy
was one of
work,
those
dog.
stupid. And like after that, I started doing research on it and like all these chains, and they're always and they. Another a friend of ours told us also that they like sometimes they just change the name because they're getting all this like heat from the law, and they just change their name and everything.
Oh,
And
the
it's
company?
the same people, yeah. It's the same people. Like
I think so.
they
I think
switch
that might
things
happen.
around.
I've never really been in that and thought about that. But the office that I bought was Floss or Soothe. It was Floss before, so it went to like 2-3 different name changes.
Yeah.
I don't know, and it was the same lady. So I'm
You
like,
see,
why,
so
would,
maybe-
why would you change your own name? I'm doing all this work for Royalty Smiles. Why would I didn't change it?
Yeah,
Like,
yeah, multiple times.
Yeah,
So then
yeah.
it's true. Like the whole dental chains is like,
oh
like,
nah, bro.
don't go there.
I wouldn't go to. If you really care about your teeth, don't go to don't go to a dental office that you see one in every city or every corner. I mean, come on. It's like the.
That's true.
It's like the Walmart. Like it's like the bottom. Like they're just trying to make the money, and their main set. They'll be giving the kids pizza in the lobby. Come on, dude. If they know that people are on Medicaid. They say, come on in. We have pizza. There's a area for video games. What does that have to do with
Yeah, dude, the one that I went to in San Juan had an arcade.
What does that have to do with dentistry, bro?
And a massage chair, and it had an
They're
arcade.
just trying to make you comfortable so they can do whatever they want on your teeth. And it's crazy.
Man, dude.
Dude, you see, as I say it, you're like,
we
wait
need
a
to-
minute, that was weird.
We need to hear. Yeah, there was an arcade, and I was like, oh man, like I thought, like okay, they're helping out the wait times and everything, but
Nah, bro. It's so that your kids are saying, I want to go to that dental office because guess what? They're going to give us pizza and they have that video game.
so it's like way more business than healthcare. Like it's just
Absolutely.
yeah.
Absolutely. So that's why it's important to find that. You got to find that. I first of all will recommend you have to go to a privately owned dental office, bro. When it comes to your health, bro, you can't go to a chain. You got to go to somebody who's a one person that's dedicated to one office. The same person is going to be seeing you every time you come in. Because the thing I hear is, yeah, we'll go to our appointments, but it's a different doctor each time. You want a different doctor to take over where the other doctor left off that quit? What?
Yeah.
You know what I mean? So I don't know. You need to find a privately owned office and then, gauge how much the person cares about you. I mean, you can kind of tell how much are they really explaining? I mean,
Yeah.
you from your experience, you're clearly telling me they didn't explain anything to you.
Yeah, I mean, they definitely charged me, but
Exactly.
Yeah.
So yeah, it's important to get that comfortability with your dentist, but not just comfortability from your point of view. You need to know that he's acting like he cares about you. He's talking to you, looking in the eyes, explaining what each thing is, and so you can leave informed.
yeah, for sure. Yeah, you're supposed to, man. But of course, I mean, I listened to them.
Yeah, because I mean, look, you could have also had those 3 cavities, but wouldn't it have helped if they took a picture and showed it to you, or they showed you on like you saw your teeth?
Yeah.
and they said, "This is what we're trying to fix." That way, you can make the informed consent whether I want you to fix it or not.
Yeah, true.
At that point, if you really care about your teeth, wouldn't you say, "Yeah, go ahead and fix that"?
Yeah,
But at
for
least you're
sure.
showing me, you're giving me the chance to give me my educated guess on what I need to. But I know dentistry can be very like hidden language. Okuzulingual, ML on this. You're like, what are they talking about?
Yeah,
So-
that definitely happens a lot, man. Well, at least we found someone here that does care about his patients, man,
Amen.
his work.
Amen,
And
yeah.
speaking of that, dude, you're even having that extraction day, right?
Yes,
Or what is
we
that?
are. So on November 8th, I'm hosting an extraction day. I'm hoping this is the first annual one. I want to do it every year. And then, we're going to do on November 8th, anybody that needs a tooth taken out, It's just one tooth per person because we're going to have a lot of people show up. Just anybody, just trying to help people in need. People have that tooth in the back of their mouth that's been hurting or in the front. Come on in. I have 2 other dentists that are going to be helping me from the Valley, one from Harlingen. Yeah, 2 other dentists reached out to me. They love the idea. The pre-registration is going to be November 5th, 6th, and 7th. So you come in during those days. We take the x-rays. We find out what tooth. We schedule you. So that day you come, it's in and out, right? And we'll have chairs set up, trays set up. Just come on, boom, boom, boom.
Ready to go.
Yeah, man. I'm just trying to serve as many people as I can, bro.
Has you ever done something like that where it's like that level?
I have not personally. This is the first time I'm doing it with my office because I've only owned my office for 3 years, but I've volunteered a lot of my time for doing stuff like Operation Border Health. It's here in the Valley. Operation East Texas. They have a lot of stuff like that. They've done it like once or twice a year, and I'm always volunteering, bro, with things like that.
Yeah,
and it's always such a blessing to see how many people that we do to help, and it's just
people show up.
Man, people are so happy, bro.
Yeah,
people are so happy, bro.
And you do get a crowd. People show up.
Oh yeah, a lot of people, man. It's like over like 3,000. Like it's a ton of people. They come line up in the morning. People need dental work, man.
Yeah,
they just can't afford it, and it's like, I pride myself, man, on people that don't have insurance. When they come into my office, man, I really do try to help them out, man. I discount. I can't even start to talk about how much free work I've done because
that's awesome,
we didn't know it was getting to that point, and their insurance wasn't covering it, and this lady really needs it, and I just look at my freaking wife and just give it to her, baby.
You can't knowing that she's gonna go off like that.
Nah, bro. The lady really wanted it. She's a good person.
That's hard, man. That's hard.
As long as enough money has covered the actual procedure, bro, I'm not trying to make all that extra because, there's a lot of, the lab fees is all I ever really want, Yeah, man.
Yeah, that's awesome, man. Because, at a certain point, it's like that human in you. Like, you just can't.
Hey, man, it comes back tenfold, bro. Yeah. Like, that lady's going to leave, and she's going to be telling everybody and their friends, go to that guy. And,
that's true,
I'm so grateful and blessed for that, man.
And she's going to stick around, too, with you. Bro. Yeah, you take care of her.
They'll come by and bring some cookies or something, and I was who brought that? Miss Valdez? Hey, come on, girl.
Miss Valdez, that's cool, man.
Yeah, man.
You know everybody by name and everything?
Oh, yeah, I love my...
How many patients do you have, man?
Probably over 2,000.
Oh, man.
I have principals, politicians. I got a lot of people, man. Yeah, it's a mix. I have some actors.
Oh, cool.
Yeah, I have some actors. I have some...
You like whitening stuff, too, or what?
I have a UFC fighter.
Oh, from Harlingen?
Diego Ferreira.
Or where is he from?
He's from...
UFC. I was thinking,
I think.
Yeah, I was thinking boxing.
Yeah, UFC... Brandon Figueroa.
Yeah. He recently had a fight. Like
he did.
I think it was like weeks ago or days ago.
It was like a week or two ago. I watched it.
Did you?
Yeah, because the other guy, Benavidez, fought Pacquiao. They were on the same card.
His opponent.
Yeah.
I think it was like 2 weeks ago. Like
about 2 weeks ago.
Saturday.
It was 2 weeks ago because absolutely.
Yeah, that's cool. Yeah,
man. Me and my wife watch it. We like to support all the local.
Yeah.
Local anybody, bro.
Me too.
Like, I really love the Valley, bro. Like, I really do, bro.
Cool, man. That's cool.
Bro. Like, I can't fake it. And sometimes, so it's really heartbreaking sometimes when I see, like, people from the Valley that hate on the Valley. Like, I don't know. Like, why aren't you trying to help your people? Why aren't you trying to support your people? Like, I'm not the only dentist in the Valley. Like, why aren't other dentists trying to, like, do more for their people? Like, why is it all about the money, bro? Like, I don't really get it. Like, the money will come back, bro. But, like, it's just, like... You know what I mean?
Yeah, it's a lot of, at the end of the day, it's a lot of the time like the values and mindset, what you prioritize, your idea of success, your definition of, happiness or whatever.
Yeah.
Unfortunately,
and I'm so grateful I work for myself, man, because I can do whatever I want, and I can do this because this is what I consider happiness, bro. Yeah, it really is. It's a lot more fulfilling, bro. Like after all that money or getting to whatever it is you're chasing, there's an emptiness there, bro. And it's this, You
don't want to feel that. Yeah, eventually, we hear that all the time. Like eventually, you still feel like there's something empty, right? Like
man, it's really just following the word of God, bro. Like and just serving people, bro. It really is. It just comes down to how much of a grasp of religion and God do you actually have? What relationship do you have in God? Because if you don't see life as bigger than you ain't going nowhere, man. There's always going to be that hole.
Yeah, and you said this. So going back to that real quick, it's going to be at your clinic, your office.
Yeah.
That extraction day.
Yes.
In November. Okay, that's you. So it's in McAllen then, right?
It's in McAllen, 4501 West Expressway 83, Suite 10, McAllen, Texas.
Okay.
Yes, sir.
Hey, so what are the hours of your place anyway?
Okay, so that's good.
Because now I gotta get away from these chains, man.
Hey, no, so the hours of my office is, it's a little unorthodox, but
Okay.
it's open every Saturday.
Okay.
Okay, so we're open Tuesday through Saturday. Tuesdays is 10 to 5. Saturdays 10 to 5.
Okay.
The other days, Wednesday through Friday, are 12 to 7. So I open later, but I stay late. Open late. I get a lot of people who want to come in after work.
Yeah.
So that thing you mentioned earlier about just being able to get off, people always get to my appointments because I have weekends and I have after out. I mean, you need to.
Okay. Well, how did that happen? Like, what made the unorthodox schedule?
When I acquired the office from the previous owner, all the hours are 8 to 3 or 8 to 4, 8 to 4. The typical dental offices, no open Saturdays, and Friday was like 8 to 2. They close earlier. That's how it typically is.
That's what I found. That's why I had to go.
Exactly. Yeah. And I first thing is I'm not a morning person, dude. And so first thing is first, I said, we got to move it all up to 10. Man, I'm not trying to see all this early because I don't know. I think it's muy important. So I say muy, very important that the healthcare provider is comfortable, is in his best. You don't want your healthcare provider mentally off when they're working on you.
You gotta be in your zone, man.
Amen. And that's the thing. I have to come to my acceptance of myself, and I need to feel comfortable in my office to be able to give you the best quality of care. That's why you see the personality. That's why you see the clothes. Yeah. Bro, I've tried to wear scrubs every day. I've tried to button up, man. I just feel uncomfortable.
Oh, you don't do that?
Hell no. Okay. I wear scrubs maybe once or twice a week.
So you show up in fits on the other days?
I've worn this to the office.
Oh, really? Yeah. Okay, that's cool, man.
If I get a new patient who I kind of read people, I'm a people reader to be more energy. If I see the energy of somebody, I might just go throw on my white coat and walk in there just to make them feel.
Oh, okay.
And then before you know it, you get the energy. Oh man, they love me. Then I go. I'll be right back. Take off my white coat, come back.
But you did it for them anyway. Like it was for them.
Yeah.
That's cool, man. Yeah.
Some people show up to my office wanting this Ebere, and then some people come in like, I've heard a lot about it, but is he really a doctor? I guess I got to put on a white coat.
You have to trust that the mental image of the authority. That's cool, man. Dude, people are gonna remember you then. Like, there's no way you're gonna forget Dr. Rivera. Like, you know what I mean? Like you're, as soon as anyone thinks, if anyone's been to your clinic, next time you think dentist, they're they automatically
refer me. Yeah,
they're gonna think of you first, man, because you're not like the 99 others, man. That's cool. Like you're probably not even trying to do that. You're just being you.
I am.
But dude, like that's I guarantee you, people are coming back because they're gonna remember you versus like the 50 other white coats.
I mean, my journey working at other offices was pretty rough. I mean, they would always try to get me to shave my beard off.
Oh, yeah?
I don't know why that mattered. It's not like I was looking shaggy. A lot of dentists would try to make me shave it. And they're like, I just don't want the patients to... Bro, what are you talking about? It's the beard. But they don't understand what they're really asking because it's a part of my personality.
Yeah.
It's a part of me, bro. Like, if I shave it, I will come to work feeling awkward, feeling different. It's like somebody saying you got long hair all your life. They saying shave your hair off because you're now in this profession. What's that got to do with me doing my work and being professional?
Yeah.
So
and it's actually going to affect your
my mentality.
Yeah. And also your work too.
Work.
Yeah, because you're not on your game.
I'm in my head. Yeah.
Yeah, dude. The mental game is huge, dude.
Man, in everything in the world, you have to be mentally stable and comfortable to perform your best and do, just to live life,
That's cool, man. So I got one more question for you, man. Is there anything you want the Valley to know? Anything that we need to hear? Anything that we need to, we need to be put in our place for? Any public service? Anything at all? Anything you want to tell us that we're doing, that we're not doing, that we should be?
Well,
that we shouldn't be?
I think that the Valley needs to stop underestimating the doctors they have here in the Valley and skipping to just go because things are cheaper in Mexico. I think they do that a lot. And the quality of care really shows. Now, I'm not saying there aren't good doctors in Mexico. They're just not it's just not as common. I just see the work. I mean, I'm just saying, like, if you're paying $50 for that, and we got quoted $2,000 in America, there's a reason for it. Those composite veneers, I do veneers, by the way. I do great
Okay.
veneers. Beautiful veneers. You got to check out my page on Extraction King on Instagram.
So you are an artist, man.
Oh my God, I'm such a perfectionist, bro. I mean, you can't sit there and look at me with your your composite veneers from Mexico and tell me how much you love them, bro. I'll just you don't really want to know my opinion. You don't want to.
Don't even ask.
We can tell your teeth are like an inch thick. Like how dare you? Like come on, dude.
An inch thick.
Yeah.
Well, that's true. This guy wanted to be a plastic surgeon, right?
Yeah.
So.
No, I'm all about not just how it looks, but the texture, the feel. Does your tongue, can your tongue tell the difference? No, your tongue shouldn't be able to tell the difference, you know? All of that stuff. The way you speak after you have it. Does your breath start to stink? It's probably done wrong. You know what I mean? Yeah, I'm just not really a big fan of composite veneers in all because I hate to say it, if you're going to get veneers, there's going to be some kind of light shaving that's going to seal it really well.
Oh,
if you just get stuff put on top of your teeth, you're kind of just creating more crevices and areas where food can be trapped.
Yeah.
Especially when you already have bad oral hygiene. A lot of the people that are wanting veneers are people that already have poor hygiene. They have cavities and they just think, I'm going to get veneers. Well, what about the actual health issue you have in your mouth? Veneers are just aesthetics now. I need to clear that up for people. They're really just an aesthetic thing. They're not supposed to help you with your cavity. You need to find a doctor who's going to do your veneers, but at first he's going to look at your teeth, get rid of the cavities, take out the bad teeth so that you have veneers and your teeth aren't rotten underneath.
Yeah, are we doing that in Mexico? Is that like
that's kind of what
you see that?
Dude, I've gotten from people, well, they didn't take any x-rays. You got veneers and they didn't take any x-rays? They don't even know what they're putting in their teeth. You know, I've also pointed out, you know, I got these teeth, you know, in Mexico, cool, whatever. I'm not ever judging my patients. I don't, but when you're in my chair, you're going to listen to what I got to say. These teeth just have been bothering me. I think it just needs to be shaved down, though. And I do the x-ray. Ma'am, you have huge infections. These teeth need root canals and crowns, and one of them needs to be pulled. It's just bummed down underneath. But you can't see that underneath that thick, bulky white thing.
Yeah.
You're just like, but something doesn't feel right, bro. Your whole face is about to explode, bro.
That could get to your heart, right?
Dude, that could get to the infection can travel right into your heart.
Yeah.
All that's connected, man. Especially the ones up top, the teeth up top, they're connected to they're in your sinus. So it's like a mouth, oral, and eye communication center right there. So when you start feeling like something, it just feels weird. I feel stuffy, like, my allergies. Everything ain't your allergies. Go get your teeth checked out. You know what I mean?
Oh, I see. We probably needed to hear that, man.
Yeah.
I bet you none of us knew that.
Yeah, you're getting some kind of stuffy pain in your nose region, your sinuses. Go get your teeth checked out.
No, but no one's gonna think that.
Nobody's gonna think that.
Yeah.
But a lot of times it's because you have an infection.
Really?
Yeah.
And you just won't know.
Well, you know.
Well, but you won't know that it's the teeth.
No, you might go through the typical line of order, right? You go to your healthcare professional. They're like, well, everything looks good here. Have you considered going to your dentist? They typically always say that.
Oh, okay.
Yeah, they know what's up. So it's because nobody knows teeth like dentists, bro.
Yeah.
Anybody can say, oh, dentists aren't real doctors all you want. Go to a doctor and see if they can fix your teeth.
Yeah, that's true.
They don't know what to do. Yeah. So, yeah, besides that, before you go to that oral surgeon, come check out Extraction King.
Okay. Well, now I know where it is.
Yeah. I take them out. I take them all out. I don't refer none out. And everybody has a great experience. I mean, I always record people and they're just like, yeah. And people are just like, you just took out his teeth. Why is he actually so normal? Because the thing about the teeth, taking out wisdom teeth is really going to be, make sure they're numb. You're not going to feel a thing if you're numb.
Yeah, literally.
But a lot of people can't, a lot of dentists are afraid of numbing well. So go to the oral surgeon. I don't want any problems. And et cetera. But I have all the experience as well. I was known for taking out the most teeth in dental school.
Oh, yeah?
Yeah.
Oh, wow.
At Baylor, yeah.
So you keep a count?
They keep a count. And so
you take out the most teeth?
There's a checklist we all have in third and fourth year.
Yeah.
You have to do so many root canals before you graduate. You have to do so many teeth. To make an A in teeth, you have to do 70. I did 700 and something teeth.
Like what do you mean? Like cleanings or extractions or?
Take them out.
Oh, that's why you're Extraction King?
I got the name Extraction King in dental school.
Oh, they gave you that?
Yeah.
Oh, man, I thought you...
I didn't just make it up. They're like, Extraction King. I was like... Yeah, that's my
It's
name.
still on the wall, like.
Dude, I know they had like a plaque, but I mean, they've reconstructed the whole center. The school has actually been rebuilt down the street or whatever. So I don't know if it's ours was like looking kind of old retro. They had like a whole plaque on the wall, extraction people from the previous year. And
That's
I
cool,
blew it all out of the water.
That's cool. All right, guys. So, well, I guess one thing, it's not as simple as just going to Mexico real quick, right? Like there's more involved.
Exactly.
All right.
Exactly. Always just check with your local dentist. Get a diagnosis, and if you want to at least take that diagnosis to Mexico, then that's at least one step closer.
Yeah.
But I mean, you always want to get an opinion from here. But I would suggest just come to Royalty Smiles, and I'll take care of it.
Okay, there we go. Or at least make sure that your dentist knows what they're doing, right?
Yeah,
like if you're over there,
exactly.
That's true, man.
Well, and one more thing, real quick. Occasionally, I run promos where it's free exams and consultation, X-rays and consultations for the month. Like this July, I was doing that all month. I plan on doing it every 6 months. So people that don't have insurance can at least come and see what's wrong with their teeth. You know, you don't have to. Yeah. So we can at least just take care of the one major thing or whatnot.
Okay. I'm probably going to tell a couple of friends about that,
man. I also offer financing, you know, so if you have any kind of credit, you might get the funding to pay for your teeth at a time and you can pay monthly, you know. So I just try to have a lot of avenues for where people can get their teeth taken care of. My cleanings are $50. That's literally what it is in Mexico. So why are you going to Mexico? Right?
Okay.
Exactly.
Okay. Yeah, I'm going to tell some friends for sure. We just told everyone here too.
Amen.
All right, guys. Well, check out the Extraction King, given to him by the School of Dental Medicine
Baylor
or whatever.
College of Dentistry.
Baylor College of Dentistry's Extraction King, over 700.
Yes, sir. That was in dental school. I've been in practice for 10 years. I've extracted probably 7,000 teeth by now.
All right, guys. Well, check him out. Royalty Smiles.
Royalty Smiles.
All right.
Yes, get treated like royalty.
It's not gonna. Okay,
that's my brand. That's my brand.
That shut me up, man. That shut me up real quick. Hey, well, this is not gonna be the last time.
Yes, sir.
It was the first time.
I'd love to do it
we'll
again.
do this again. He's next time he's gonna bring his Frenchie.
I will. I'll bring one of my Frenchies. I have quite a few of them. And don't forget, November 8th is the extraction day for the community. Pre-registration is gonna be 5th through the 7th, and just come in there, and that's when we'll take the X-ray. Tell us what tooth we'll schedule you, and no payment. It's free.
All right, guys. Don't forget to smile. Don't forget to floss.
Yes, sir.
All right, we'll see you guys later.
God bless everyone.
Got some time with Dr. Ebere. So we'll see you later, man.
God bless.
Right, yes, sir. You too.
Awesome.